Hi, my name is Jessica Clotfelter, and I'm the Rehab Director at Claps Nursing Center here in Pleasant Garden, North Carolina. And today I'm joined by Whitney Gaulden, one of our speech therapists. We wanted to talk about how we've been successful in implementing the medication management portion of our Safe Transition program here. So Whitney, can you talk a little bit about how you guys start your intervention and intake for the evaluation process?
Sure. So when we get a new admission here, we'll go ahead and give them the slums assessment. We'll determine if they have any cognitive deficits or any visual, spatial kind of deficits that might further, be a barrier to our medication program. And we'll also do a family interview and patient interview just to see what they were doing at home as far as their medication management and what level of care they were needing, and then what level of care to expect at discharge.
That's really cool. How do you go about, once you have that intake portion completed in your evaluation, how do you turn around and provide the treatments to compensate for the barriers you identified in your standardized test in order to decrease that rehospitalization rate?
So part of our treatment that we will do is we'll do the alpha. It has a really functional portion in there for medication management. There's labels, there's questions and setup about medications, and then we'll kind of determine how successful they were with that, and pretty much we kind of know right away if they're going to need more help with that. And then we go ahead and make a medication chart, and can be done with the patient or the family. We add stuff like medication on there, the use, like the purpose for the medication, the dosage, and the instructions. And then from there, we can highlight or bold things if they have visual deficits. And part of the other thing that we do as far as visual deficits is we'll do an informal visual assessment just to see what font level they may need, or what their reading level is, just to make it easier for them to understand and be more successful with it at home.
And you guys use the Word app on your iPad for
That's
that,
right.
correct?
Yep.
The other thing that speech has done here that's been very successful is not recreating the wheel completely and using a lot of the resources that are found in our Safe Transition framework on box. So a lot of the medication interactions, the health literacy stuff, they incorporate really well with explaining why this medication is important and what it's working to address. So I think that's been really cool, and it's been very successful here. So one of the other components that we added was using the Toolkit guideline that's also found in our Safe Transition folder on box. And we reached out to our pharmacy here on site, and they were able to provide us just about everything on that list, including the pulse ox, the blood pressure cuffs, things like that, so we can practice as real treatments as we possibly can. Yeah, it was all for free. So Whitney, can you talk a little bit about some of the things that we have in our toolkit?
Yep, so we have a couple of organizers here. We have one that has several times a day, and we have one that's just a morning and night. And then we also have punch cards. It makes it a little bit easier.
And our pharmacy was nice enough to, on our punch cards, give us a medication label that we can also practice. But they also use the resource found in the Safe Transitions with the reading label activity.
And then we have, of course, just your standard medication bottles, inhaler, EpiPen, syringe, and some pill splitters. We have two different pill splitters. One is more for visually impaired, is clear and see-through. We might get those patients who are having swallowing troubles and they need their pills cut in half, or they may have to take a half dose, so we go ahead and set them up with that.
And one of the things that speech does for us in occupational therapy is that they notice during the treatment that the patient can successfully identify their medication, but they can't get to their medication due to arthritis or an impairment with their hands or inability to be able to press the inhaler. They'll let us know so that we can modify our plan of care to make sure that we're being as successful as possible for that patient. So.
And with that, we can make recommendations. If they're not able to open the bottle, we might call the pharmacy or talk to the family about getting them a punch card. We can call the pharmacy and ask each individual pharmacist, whoever they go with, ask them, what they provide as far as people with memory deficits or trouble opening prescriptions.
So if, here at CLAPS we have been successful with this, so I encourage each of you, if you're not doing medication management in your clinic, to kind of sit down and talk about that as a team. It brings a great added benefit to the patient, but also what we've been able to do is show our customer the added benefit of us as their rehab choice. We've had hospital personnel come in, doctors from other hospitals and private practices, and along with our home health agencies that we work with, they are very impressed with the level of attention that we apply to medication management. And it's something that kind of sets us apart in our community here with our focus on it. And we've seen great results with decreased hospitalizations when we discharge people home. So medication management is not a big scary thing. It's easy and it's really fun. So we hope this was helpful. And Whitney, thank you for your time.
Thank you.